Dr. Cindi Marquette here to talk a little bit about bioidentical hormone replacement therapy. So what is BHRT, or bioidentical hormone replacement therapy? What it is it's atom for atom is exactly the same type of hormones that you used to make back when you used to make them. We are going to be talking about hormone deficiencies, excesses, imbalance, and what to do if we have any of those situations. So as part of your information package, when you looked at this, you'll be getting a little checklist that looks something like this. And we want you to answer this honestly with how you feel currently, like within the last couple of weeks. Some of the things that we can see when somebody's hormones are out of balance is we can see extra weight, insomnia, irritability, joint pains, brain fog, lack of libido, lack of sexual function. So these are the main things that we're kind of going to address. So what are hormones? So hormones are chemical messengers. If one part of your body wants to talk with another part of your body, they're going to send out these messages, these signals. They let us know when we're hungry, when we're full, when we're tired, when we should wake up. They regulate our heart rate, our digestion, our brain function, kind of everything. And we've known about the existence of something for hundreds of years, but nobody knew what the heck that something was. They used to do all sorts of crazy experiments on animals, and back in the 1700s, they took boys that had a good singing voice and they'd castrate them before they went into puberty, so they could have a nice high soprano voice in the opera, and these boys were called castrados. I don't think we're doing that too much these days, but I don't know too much about the Vienna Boys Choir. And male scientists used to take men's testicles, cut them off, grind them up, inject it into their body because they knew there was something that was coming from down there. But like what I said, we didn't know what it was. It wasn't until the beginning of the 1900s that we finally were able to isolate hormones in a lab. And once we started doing that, we started doing a little bit more humane experiments. So the first big study was done in 1939, looking at women that had hysterectomies because of cancer. So these ladies didn't have any parts. They weren't making any hormones. And what we did is we replaced their lost hormones with the natural ones, and boom, they felt youthful and vigorous and life went on. We've known since 1949 in women that went through menopause, meaning they stopped making hormones naturally, that if we replaced their lost hormones with the natural hormones, they felt great afterwards. Enter the drug companies, enter the pharmaceutical companies. They wanted to get on the bandwagon. They wanted to make some money off this. But the problem with natural hormones is that word natural. You cannot patent something that occurs in nature. So I can't go outside, pick an apple off of a tree, take it to the patent office and say, hey, I want this called the Marquette apple. It doesn't work like that. So what these drug companies did in an effort to make money is they took these natural molecules. Let's say estrogen. Let's say it looks like this. They changed it, they modified it, they put a little chemical group on the end of it. So it kind of would look the same, would kind of function the same. Oh yeah, but it wasn't the same. But it was unique. They could take it to the patent office, get a stamp of approval, take it to the FDA, develop a drug, and voila, Premarin was invented, which was artificial estrogen derived from pregnant mare urine, Premarin. The second one that came out, Prempro, artificial estrogen and progesterone, again derived from pregnant horse urine. This was the 1940s, kind of a sexist country back then, mostly male doctors, and nobody wanted to deal with those crazy women going through midlife issues, right? So these synthetic hormones were given to women kind of across the board. And yeah, they seemed to be behaving better. They weren't so moody and irritable and having all their hot flashes and everything. But you know, it kind of seemed like they were dying prematurely. Kind of seemed like there were more incidences of breast cancers and heart attacks and strokes. So finally, in the 1990s, not that long ago, they underwent a very large study called the Women's Health Initiative, where they looked at over 160,000 women in menopause on these synthetic hormones. And they had to stop that study abruptly in 2002 because, yes, indeed, higher incidence of death, breast cancer, heart attack, blood clot, stroke. So in 2002, it was released to the media that hormones are bad. And that's where the bad press came from. Kind of freaked out doctors. They didn't know what to do with this information. So they stopped prescribing any kind of hormone replacement for women, natural or synthetic. And they estimate because of that move that up to 90,000 women might have died prematurely from not getting anything. But when we actually look at the real deal, real testosterone, real estrogen, real progesterone, we cannot find those bad outcomes. In fact, we find exactly the opposite. In fact, there have been over 700 studies done looking at natural testosterone and estrogen, enough that we're able to compile this chart. So this chart is taking a look at testosterone levels and certain symptoms that can arise. And this was done looking at men, although the same thing applies to women, just some of the numbers are different and some of the conditions are a little bit different. But if these are blood levels of testosterone here on the left-hand side, optimal levels for a man who's not getting any kind of treatment, 900 to 1100. For a woman, if we take off a 0, that's pretty close to where we should be, like 80 to 120. But we find at different blood levels, we can expect different situations to rise. The very last thing that goes, and it's a totally male thing, is an ability to have an erection. It doesn't take a whole heck of a lot of testosterone for that. And I don't know if that was God's cruel joke. The last thing a man can do is have an erection. I think everything's okay with the world. Not that much of an exaggeration, but usually pretty easy fix. But look at this one here, depression. I see people every day that are depressed. They may or may not be on an antidepressant. The problem with antidepressants, they don't fix depression. They blunt you so you don't feel the lows, but you also can't experience the joys. So you're kind of in this blah zone all the time. We can usually get people off of their antidepressants and fix the issue once and for all just by balancing their hormones. Heart disease. You may not know you have any heart problems until you have a heart attack. Well, that's an awful way to find out about it. In women, we've got this magical thing called menopause. So there's a before and there's an after. The chance of a woman dying of heart disease before menopause, 1 in 7. After menopause, 1 in 3. That's the loss of our testosterone and estrogen. In men, they don't have a cutoff. It's just kind of a gradual decline. But once a man's testosterone level starts getting to be in the 300s, much higher risk of dying of heart disease. Experimentally, we're taking men in the process of having a heart attack and we're injecting testosterone into their coronary arteries and watching their heart function come back. It's that important as far as heart goes. Fatigue. This is the number one reason why people come to see me. They don't have the same energy they used to have. And really, if that's how you're feeling, what? I'm supposed to sit there and think about having sex now too? Isn't that just another chore that has to be checked off? But you replace those hormones, that energy comes back, that sex drive usually comes back pretty darn quickly. Type 2 diabetes. This has become huge in America right now. Terrible diets, terrible lifestyles. We're getting fatter and fatter as a nation, and more people are being diagnosed with diabetes. We can oftentimes get people off their diabetic meds by balancing their testosterone and estrogen. Of course, they have to do their part by eating a little bit better, but you don't have to be perfect. Mortality. Low testosterone in a man is a risk factor for premature death, period. And that's a level of 600. 95% of the men that walk through my door are under 400. For women, it's not just the loss of testosterone, it's the loss of testosterone and estrogen that causes our premature death. So let's go back in the 1900s again, before antibiotics. Nobody cared what happened to a woman after menopause because chances were you're going to die of pneumonia, urinary tract infection, or the flu. Well, now we're living 30, 40, 50 years longer, so we do kind of care what happens to us. Osteoporosis. Testosterone replacement by pellets increases bone density by 8.3% per year, way more than a load-bearing exercise or calcium or magnesium or vitamin D is going to do. Metabolic syndrome. So this is a condition being overweight, high blood pressure, high cholesterol, type 2 diabetes. When I went to medical school in the 80s, we hadn't even heard of this yet. But this is something we've developed as a nation because of our terrible diets and lifestyles. But not only can we get people off their diabetic meds, but oftentimes off their blood pressure and their cholesterol medications just by balancing their hormones. Prostate cancer. Right now in America, the incidence of prostate cancer in men is 1 in 3. When I went to school, it was 1 in 8. It's gotten that much worse over the past few years because of the toxic world that we're living in. And low testosterone in a man is a risk factor for prostate cancer. And if we want to prevent it, we need to maintain a level about 840 or so. Like I said, most of my men are down here. In women, testosterone replacement by pellets decreases the risk of breast cancer by 50 to 70%. Huge, massive. We've got nothing else out there that remotely comes close to those numbers, but you don't ever hear about it because it's natural. There's no money behind it. Alzheimer's disease. This has been now reclassified as type 3 diabetes. Same thing that causes regular diabetes, but focused more on the brain. And we're expecting more and more as we get older as a nation, and we tend to see more in women than we do in men. So let's think about this. Both sexes have testosterone and estrogen in the brain. Men tend to have a lot more testosterone, women a lot more estrogen. Estrogen is very protective for the brain. So when we lose it, when we go through menopause, we take a bigger hit than a man. So we see about 8 times as many women with Alzheimer's as we do men. But in men that have testosterone levels below about 900, 3 times increased risk as far as developing Alzheimer's. In traditional medicine, we don't have anything to stop that train from progressing, but we can help to prevent it outright by keeping those hormones balanced. Sarcopenia, this means muscle wasting. If you don't have enough testosterone, good luck having enough energy and motivation to exercise, and then oftentimes people get frustrated. I can't do what I used to do. Now I'm more sore, more tired, it takes me longer to recover, so why bother? You replace those hormones, now you've got energy and motivation galore. You can't wait to do something with it. Times are faster, reps are higher, weights are heavier, and recovery from workouts are improved. Arterial high blood pressure. We used to expect that once you're diagnosed with high blood pressure, that's it. You're on medication for the rest of your life, period. End of discussion. What a terrible way of looking at things. Again, it's that balance of testosterone and estrogen that keeps the blood vessels nice and supple, and oftentimes we can get people off their blood pressure meds or at least lower their dosages of them. Abdominal fat. When everything else stays the same diet, same lifestyle, and all of a sudden you start getting that personal flotation device around the middle, rather than beating your head against the wall thinking, what kind of crazy diets they push in these days, think about balancing those hormones. It's very reproducible how belly fat melts away. Not overnight, but over months. Men are lucky. They can almost stand in front of a mirror with a time-lapse camera and watch their body change. Women, we've got to work a little bit harder at it, unfortunately. Dyslipidemia, this means an abnormal relationship between your good and your bad cholesterols. That's what contributes to hardening of the arteries. We call that atherosclerosis. That's what causes strokes and heart attacks. It takes about a year's worth of treatment with testosterone, but oftentimes we can get people off their cholesterol meds. And one thing that's not on there that I wish was on there is arthritis or joint pains. Whether it's rheumatoid arthritis or degenerative arthritis, or you've had an injury and you have pain, people come in to see us when they're having pain. We treat them with testosterone. Oftentimes the pain goes away. They know it's time to come back in and get retreated when the pain starts returning. Stop. So the reason we talk about balancing hormones is, yes, we want to get you feeling better now, but gee, I'd certainly like to help prevent some of those diseases from coming up in the future. Particularly, I want to protect your brain and your heart and your bones and your breasts or prostate if you're a man. So where do we get our hormones from? Testosterone was originally derived from yams, estrogen and progesterone were derived from soy. So why can't you just eat soy and yams and call it good? Well, to do that, you have to swallow those plants, they need to get inside of your gut, and then it gets metabolized by the liver. Well, once the liver encounters it, it neutralizes it. So you'd have to eat pounds and pounds of those plants to get your numbers up, and that's just not practical. So what we do is we isolate the chemical structure from that plant. There's no soy left, there's no yam left. What we've got now is a white powder. Now, how do you get that white powder in your body? The one way you do not do it is by mouth. There is no safe, effective testosterone or estrogen that's natural that you can take by mouth. Actually, you can go to a compounding pharmacy, they'll be happy to take your money and make some for you, but it doesn't work for the same reason those plants don't work. You have to swallow it, it needs to get inside your gut, and then the liver is going to neutralize it. So if you hear of somebody taking testosterone or estrogen by mouth, chances are it's synthetic. Premarin, Prempro, birth control pill, completely synthetic. All right, so that doesn't work. I can take that white powder, I can mix it into a cream or gel, put on my skin. Sounds pretty good in theory, except for one big thing. Your skin's designed to keep things out, not to let things in. So we've got a problem as far as absorption. Only about 23 to 45% of any cream or gel I put on my skin is going to get into my bloodstream. And then I have to remember to apply it every day, and ideally it's twice a day. I can get people to take a vitamin once a day, let alone a messy cream or gel. For women, the best place to apply it is on the inner labia. Thin skin, rich blood supply, much better chance as far as getting absorbed. From a practical standpoint, kind of messy, maybe have a little bit of a discharge, maybe have to wear a panty shield, and let's say you want to have sex hours later. Very transferable amongst partners. So he might not mind testosterone, but he sure as heck doesn't want a part of any estrogen. Costs about $50 to $70 a month, can oftentimes get your blood levels up a little bit, maybe a little bit improvement in the symptoms that you're experiencing, but most people don't stay with it because it's a lot of work for very little return. So what about shots? The problem with shots is they're 99% synthetic. It's not just testosterone, it's testosterone cypionate or testosterone enanthate, it's testosterone something. If you see a word before or after the words testosterone or estrogen, that means it's synthetic. With synthetic, we've got a higher incidence of death, cancer, heart attack, blood clot, stroke, just the things that we're trying to prevent from happening. Let's say though, despite that, you wanted to go ahead and try it. You start off with your blood levels low, not feeling particularly good, you give yourself a shot, 12 hours later, your levels up here feel pretty dang amazing. The problem is 36 hours later, your levels are back down and you're not feeling so good anymore. So now it's time for another shot. So you're always going to have this kind of roller coaster effect. It's relatively affordable. A 10-week supply at most pharmacies is anywhere between 30 and 50 bucks. I do have some men that are using injectable testosterone, but I don't ever recommend it for a woman because I think the benefits do not outweigh what the risks are with it. There are easier ways to get it taken care of. So what else is left? I still have that white powder. What I can do instead is compress it into a pellet, and that's what we use a lot of here. If we use testosterone for both men and women, we use estrogen for women only, and only to women that need it, those that have gone through menopause or those that have had their ovaries removed. We figure out how much to give you based on several things: your age, your weight, your level of activity, your blood levels, any medicines you're taking, any medical conditions you might have. Then we come up with a dosage that's unique for you, that's very different than somebody down the road from you. And what we do with those pellets, we insert them through a very small incision, about 3 millimeters for a woman, 4.5 millimeters for a man. That incision typically goes in the upper butt cheek or in the love handle area. We deaden the skin with lidocaine so you don't feel it, and then we put these pellets into the fat underneath your skin. The reason we use fat has a good blood supply. So as those pellets are sitting there, within 24 to 48 hours, little blood vessels will start growing around them. And as those pellets start dissolving, we get 100% uptake into our bloodstream, and we bypass that nasty old liver. So if you start off with your blood levels low and not feeling particularly good, it takes about 3 days for estrogen to start kicking in for women, because it's pretty tiny. It takes about a week to 10 days for testosterone to start kicking in, because it's a little bit bigger. And then gradually your blood levels go up and up, you're feeling better and better, everything keeps going up until we hit a maximum at 4 weeks for men, 6 weeks for women. At that time, we do a follow-up blood test. That helps me to determine your dosage going forward. Do I need to go higher or lower or make any changes? And then I meet with you once those results are back to see how you're feeling. Because right now it's just words I'm saying. You don't know if any of this is legitimate. But by that time, you should know what I'm talking about. And what should happen is you should stay feeling good for months until all of a sudden there comes a day where it's like, maybe I'm not feeling so good. Maybe I'm not sleeping, or maybe I'm more irritable, or maybe I'm having hot flashes or some brain fog. I don't know, something starts coming back. And when something starts coming back, that's when we repeat the process. For women, usually about every 3 to 4 months. For men, about every 4 to 5 months. I just need a phone call at that time saying, hey, I feel like my pellet's worn off, and we repeat the process. The only 2 things that go in pellets are testosterone and estrogen. 2 things that do not go in pellets: progesterone and thyroid. Progesterone, and this is specific for women. Progesterone is like nature's Xanax. Without progesterone, we typically don't sleep. Maybe we fall asleep, but we don't stay asleep. More likely during the night to be restless, to be hot, maybe sweaty. The covers are off, the covers are on. During the daytime, more likely to be anxious, irritable, impatient. Things start driving you crazy that maybe never drove you crazy before. Because progesterone can make you sleepy, we don't put it in a pellet. No one wants a pellet in their butt that's going to make them sleep for 3 months. So instead, if you need progesterone, that's a capsule that's given before bedtime, helps make you fall asleep, helps make you stay asleep, helps to make you a kinder, gentler person, and also helps to balance any estrogen you might receive. Thyroid. Thyroid is a hormone that's made by our thyroid gland in our neck, and it helps to control our metabolism. As part of our lab panel, we do a pretty detailed thyroid assessment, and if you need any thyroid replacement, that's usually a pill that's taken by mouth. We don't put that in a pellet because your needs for that may change, and once something's inside you, I can't take it out and adjust the dosage of it. So I don't know if you've heard anything about my story, but I was an ER doctor for 35 years. Kind of a stressful job. I was on blood pressure medicine, cholesterol medicine, diabetic medicine, anti-anxiety, antidepressant, sleeping pills. I've had breast cancer twice. I tried hormone creams for a couple years. I don't think they did anything for me. I switched to pellets almost 6 years ago. Hello, somebody turned that light switch on. I currently take no medications. I'm age 65, work out regularly, and never felt better. That's what hormones can do for you. So the way that we figure out if you're a candidate for this is a couple of things. First of all, this little checklist. If you marked everything in the never category, we'd shake your hand and say, awesome, see you in a couple years. But if you start marking some of the symptoms being present, the next step is we do a lab panel. In the lab panel, we do some of the basic things that most doctors do, like looking at your blood count, your kidney function, liver function, electrolytes, protein stores, blood sugar. We take a pretty detailed look at your thyroid. We look at your vitamins B12 and vitamin D levels. We also look at your estrogen, progesterone, testosterone levels. And for men, we take a look at your PSA, your prostate markers. We can draw that blood work here. It takes about a week to get the results back. Once the results come back, I'd like to sit down and go everything with you in detail. If you want to get pellets, we can do it at that time, but you're not under any obligation to do so. Are you interested? If so, let's get some labs on you.